Hey y'all, welcome back to my channel. Mila, the Hangry Woman here, and I'm super excited to talk to you today about a really important topic in diabetes management, and it is the correlation between diabetes and high cortisol levels. It's super important for us to know how cortisol, our body's main stress hormone, affects our blood sugar levels. And you may be really surprised by some of the findings. A recent study just came out and it's called Catalyst. The study screened 1,000 patients with a hemoglobin A1C from 7.5% to 11.5%. And this is despite being on multiple drug therapies to manage A1C and diabetes. Researchers used a 1 milligram dexamethasone suppression test, or a DST test, to detect hypercortisolism in these patients. And what they found was the prevalence of hypercortisolism in 24% of those patients screened. Additionally, CT scans revealed adrenal abnormalities in about 1/3 of these patients, a quarter of them having an adrenal tumor, suggesting that surgical intervention could possibly solve their hypercortisolism and therefore make it easier to manage diabetes. These results are pretty incredible, considering that type 2 diabetes is often looked at as a lifestyle disease, as it has factors that can be changed by lifestyle. But hypercortisolism is an under-recognized barrier when it comes to managing type 2 diabetes, and it's not often screened for. Now, the first part of this study really underscores the importance of screening for hypercortisolism. However, the next phase of the study will uncover whether hypercortisolism control and being able to manage that through medication or surgical interventions could also help with the management of type 2 diabetes. Now, let's talk a little bit about cortisol. What is it? How does it work in our bodies? And how can it affect diabetes management? Cortisol is a hormone that is produced by our adrenal glands. It plays a significant role in how our bodies manage stress, metabolism, and it supports our immune function. So think of cortisol like your body's built-in alarm system. It's going to alert you when something is wrong. It's going to activate when it seems like something is off, and that stress hormone is going to secrete into your body. But here's the kicker, is that cortisol also affects blood sugar levels. Cortisol influences glucose metabolism and insulin sensitivity. When we're stressed, cortisol levels can rise, which can lead to us having higher blood glucose levels. Managing diabetes becomes even more difficult. High cortisol levels can lead to symptoms like weight gain, hypertension or high blood pressure, and increased anxiety, which can all be hindrances to proper diabetes management. So let's discuss some strategies for trying to manage our cortisol levels as best we can. First up, stress management techniques. So these are the lifestyle factors that you can think of, things like meditation, getting regular exercise and movement, even therapy, and being able to talk out your emotions can all be elements that reduce those cortisol levels and lower your stress. Also, ensuring that you get enough sleep and you get quality sleep is incredibly important. And practicing those relaxation techniques can really help you get on the road to managing those stress levels. Of course, we want to maintain a healthy diet. So a diet that's lower in sugar, a diet that is lower in caffeine, and incorporating foods rich in omega-3 fatty acids and antioxidants can be really, really helpful. So that balanced diet that we talk about all the time, it's not getting rid of carbs for the sake of getting rid of carbs, but it's really choosing really balanced meals that are going to keep your blood sugar levels stabilized over time. Recognizing symptoms of high cortisol is also really crucial. So if you notice an increase in your blood pressure, weight gain, or emotional effects like anxiety or irritability, it might be time to ask your healthcare provider if you can get checked and make sure that your cortisol levels are in balance. And if not, coming up with a plan of treatment for you so that you can get those levels back into balance is really important. So recapping, just knowing the connection between diabetes and cortisol levels is incredibly important. And it can also be really helpful in knowing how to balance diabetes in the best way for you. Managing stress and maintaining those even levels of cortisol are really important to being able to maintain blood sugar balance and overall not increase the risk of complications from diabetes in the future. If you engage in stress reducing activities like meditation, yoga, getting movement, and even walking during the day, or you are managing your overall stress and anxiety, the things that you do to get on that path are worth the effort if it means better diabetes management overall. If you have any other questions about cortisol and its role in diabetes and blood sugar management, please be sure to ask them in the comments below. I am happy to answer them. And if you have any other questions or you need additional support, just know that you're not alone in this. I have a free app called Glucose Guide. It is available in the App Store and the Google Play Store. You are able to ask questions, find support, and also join us for our weekly sessions that just happen to be really amazing. You can get community and you can always feel like you are a part of something and there are people out there that understand you. In addition, there are also great recipes that go up in the app, and there's also a ton of information about living with diabetes. So I hope that you join. I hope that you become a part of it. The app is free with optional support. Thanks for watching. If you liked this video, be sure to give it a thumbs up and subscribe. And that's it. I will see you in the next one. Take care. Bye.